Okay, can we get the timer uploaded, please? So I don't hold you all back from your soup. Do we have our virtual speakers with us? There we go.
Hello.
Is that Emily?
Yes.
Wonderful. Thank you. Now I know we have two Emilys, so I will be looking at you for, you'll know I'm looking there if it's Emily and here if it's Emily on stage. So we're going to start with Emily on stage. Question for you. What mobility aids and/or braces can be helpful for people with EDS and HSD, and is there a risk to using them long term?
That is a whole talk in itself. There are so many devices and aids. In terms of is there a risk for them long term, we don't have a ton of studies on this, so I think evaluating it for yourself, but in my experience, that is not typically the case, that people see a lot of muscle atrophy, and that's a common question that's asked. That being said, I think looking at using aids and devices as using them as you need them, not putting a blanket statement on, I always use this wheelchair, unless that is the case for you. So a wheelchair being one example, ring splints, silver ring splints is here today. Wrist splints, I mean, there's so many different mobility and different braces and devices that I could speak to, but yeah, using them as needed and kind of reevaluating, I think having a therapist or a professional with you in that process to be sure, you can be checking your hand strength, your grip strength, things like that to assess how that's going for you individually.
Perfect, thank you. Dr. Demerdas, is it possible that you can have more than one type? So it often comes up where people think they may have hypermobile EDS and a rarer type. How possible is that?
It is possible. It's not often seen, but we do know for genetic diseases as a whole that people can have two types of rare genetic diseases. And in our expertise center, we have around 3 patients who have 2 types of EDS. And I think it's a little bit hard to say somebody has both HEDS and one of the genetically easier found types, let's say it that way, because there's an overlap always with HEDS complaints and those that you find, for example, in classic EDS. So that one is a little bit harder, but we do know patients who have 2 types of gene mutations in genes involved in several types of EDS.
Fantastic, thank you. And Maureen, how can we make the most out of doctors' appointments, especially since few doctors have anything more than passing knowledge?
Make a list before you go in. I know that's you've heard this a ton of times, but prioritize your questions. You're right, you might get a hurried or a rushed response, but you ask. So make sure you have that list and your priorities.
Thank you. And if you're comfortable, no pressure. If not, if you could remove your mask when talking, that would be wonderful, just to help people that are hearing impaired to see your lips. Thank you. Thank you so much. Appreciate it. Okay, Dr. Lakaitis. What can a patient do to protect their privacy while pursuing DNA-related evaluations and treatments?
So there are certainly questions about DNA privacy. Now, the genetic testing that is done clinically to diagnose the rare types of EDS should not subject a person to privacy concerns. There's a federal law called GINA, the Genetic Information Non-Discrimination Act, which means that people who have testing can't have that information used against them. In addition, the testing companies that are doing clinically approved testing are subject to the HIPAA law, the Health Information Portability and Accountability and something else Act, that says that they can't share this genetic information, Now, these are different protections and different issues than if you're using a direct-to-consumer genetic testing company like 23andMe or another DTC company. The laws are not the same. So if you're pursuing genetic testing for the purpose of treatment, then I'll presume you're doing it through a CLIA or CAP certified genetic testing company that is certified to provide information to be used by physicians in the medical record. And I have or very few privacy concerns with regard to those data.
Perfect, thank you for that. Emily Block. Are there any adaptations or laws that a parent of a child with EDS or HSD can get at their job?
Oh, that's a great question. So you wouldn't be covered under the ADA, unfortunately, but you could be covered under the Family Medical Leave Act, or FMLA. And these things aren't quite my area of expertise, so I would also defer to a consultation with a lawyer who specializes in this.
Perfect, thank you. Scarlett, I see so much misinformation in EDS and HSD Facebook groups. How do I know what is true if I'm not an expert?
Well, I think a lot of the things that I discussed about evaluating web content is really important. Really looking at where the source is coming from. You know, if something is posted in a Facebook group and there is no source provided, you know, it's hard to evaluate the credibility of that source when it's just someone on the internet. So I would really put your faith in the credible sources that you can find. And when possible, if you are sharing information online in these communities, always cite your sources so that others can get the most out of the information you're sharing.
I would also say, and I'm not, you know, blowing our own horn, but we will usually always share what's credible and evidence-based out there. So if you're not seeing the larger groups, not just us, there is others out there sharing that information, then I would tend to not go with it. I do follow the larger groups that have the health professionals and scientists behind them that are helping to put out the right information. Emily Rich on stage. What is the best way for students to get caught up with schoolwork after numerous absences without being overloaded?
Yes, definitely. That is challenging. And I think in part depends on if you are in grade school versus college. Those can be two different things. Oftentimes taking, you know, a piece of time off, taking a semester, whatever that is, focusing on health can really have great benefits down the road of being able to devote that time to all the appointments and travel, etc. Obviously, you can get accommodations like a 504 plan in grade school in the United States, and wherever you are, there are always things for accommodations. But yeah, if you need to take the time off, focusing on it then. Otherwise, you know, backing off of the number of courses that you're taking. I see a lot of college students who decide to try one course at a time. And then the other thing being, you know, talking with teachers specifically and seeing if you can focus on the core academic requirements. So not, you know, we like to think that school doesn't have any busy work, but oftentimes there are just a lot of assignments. Jess Salyers, the occupational therapist, yesterday spoke to this a bit. And so some of that language in there of those core academics that are required and looking at mastering skills versus, you know, getting all of these assignments completed, that can help people to feel not so overwhelmed when they get so behind.
Thank you. Dr. Demerdis, do you think that there are people out there who have milder versions of the rarer types of EDS but are just not getting tested?
I do, yes, I do. And it's not always easy to defer when you have to test and when you don't. So we try to use our best knowledge. I cannot assure that we don't miss anybody. That's unfortunately true.
Yeah. Maureen, how can parents best cope with guilt?
Sorry, I didn't hear that.
How can parents best cope with guilt?
Ooh. Yes, so you've heard about some resources. Our social workers in our clinic will have a sheet of psychologists that specialize in parents, working with parents with children with special health care needs. And these are individuals that are usually local. This list unfortunately turns over often, so I would say defer to the specialists in your area. Often geneticists are going to have access to those resources, but it's usually working with a counselor or psychologist to address the concerns and the issues that surround that diagnosis.
Thank you. Dr. Lokaitis, is there any benefit to taking a collagen supplement? And if so, what type may be recommended?
I get asked this question a lot, and my answer is basically no. I have not seen data or had experience that collagen supplements are useful. The reason that I say this is it's the way I was trained, of course, but also as I think about the way collagen works, collagen is a protein. I think I think of proteins a little bit like Legos, and you can have the most beautiful Lego house in the world in front of you, which would be a wonderful collagen supplement. But when your body takes in that collagen, it's going to break the Lego house into all of its individual pieces, then you'll absorb the pieces and your body will put it back together. So what you take in is not necessarily going to be the same as what your body does with it. So the way that it works is, you're basically getting a very expensive protein. So.
Thank you. Emily, when should you tell an employee you have EDS or a disability, and how do we best navigate this conversation?
Oh, that's a really good question. And it's a really hard thing to decide. So in general, you do not actually need to tell your employer that you have EDS. You just need to say that you have a disability and that you need an accommodation for that disability. And if you want to be, very strategic about it, it's best to do, after you have a job offer and after you've established yourself as a valuable employee, because those situations tend to have better outcomes. But again, it's not only possible. You may need to disclose prior to that. But in general, I would say wait until you need an accommodation to disclose. And yeah.
No, that's helpful, thank you. I think people often worry that legally they have a obligation to tell their employees, so that's helpful. Scarlett, how can I get my doctors to talk together about my case?
So I would actually recommend, first of all, in terms of having effective doctor's appointments individually, we have a wonderful video about that for many of our events about how to have effective doctor's appointments for my colleague Shani Weber. And in terms of asking your doctors to communicate with each other, I think the first thing that you would want to do is prioritize which doctors need which communication. So your primary care provider is, like I mentioned in my presentation, the first place to start. And they should be aware of your care more broadly than the rest. And then kind of work out which providers need to be in touch with each other. And then have conversations with your providers and ask them if they would be willing to speak to each other in terms of specific needs, and have specific questions in mind, and don't make it so broad that it's not a feasible task for them. So by having specific questions in mind and specific talking points, if you want your providers to communicate, that would be the most useful way to go about that.
Thank you, that's great. Emily, can you recommend any handwriting programs or techniques that help children with heads or other types to get better control of their hands?
Yes, absolutely. Rook, can I piggyback on that last question really quick? Would that be
Yes,
okay?
please do.
I have to brag on Dr. Lokaitis. She and I, but mostly her, started a program in Tucson with providers, and we created a network of providers that I'm still trying to keep going even though she's gone. And so I think about patients and how that relates to you and your community, and just Dr. Lokaitis had a grant that allowed us to be able to meet together and have lunch, and sometimes lunch is enough to sway providers to come out of their clinic for the day. So the point is, I don't know whether it's patients funding that or just trying to find ways to connect providers in town. It has made a huge difference in our community of people meeting just once a quarter and just throwing ideas around. But back to the kids and handwriting, I think referencing the presentation yesterday by Jess would be a really good place to start. Proprioception, or where is my body in space, where are my joints in space, is often different in people with hypermobility or Ehlers-Danlos. And so using different resources and strategies to increase proprioceptive awareness is often helpful. Kids that tear through paper because they're pushing so hard to try and get that feedback into their brain. Also using all kinds of different devices around utensils for writing, different styles. Those kinds of things can be really helpful. And usually there's an occupational therapist somewhere in the school. They can consult even if they're not seeing that child for one-on-one therapy. They can give ideas to the teacher, and often it can be a real game changer.
Thank you. Dr. Demerdas, do you know how people with a rarer type can try and explain to their local doctors about their condition?
How? Okay. I think the most important part to explain to them is that you have a rare heritable disease, and also explain where they can go to find information about what it is. If they have questions, you have, of course, your echo from the EDS Society, but usually in countries there are also some expertise centers for EDS. For example, in the Netherlands, I coordinate one of those at our center, and we do get a lot of questions from health professionals, GPs, etc. So my advice would be to sort of show them the way to get the information about the disease, because if you have to explain everything yourself, of course, that's not possible. But make it very clear that it's a disease that is very rare, but there is information out there. And I think what's important is for these people also to be known at expertise centers, because it is a multidisciplinary way to take care of these patients. And to get the right care, you need to be at the right place, I think. So that's the most important.
Perfect, thank you. Maureen, how do you know when your teenagers are ready to take on more of their medical care at home and at their appointments?
As a parent, you know best. I assess that every time I walk into an appointment, and again, it's those simple questions. So even as a parent, you can ask the same questions. What condition do you have? Tell me about it. And open that conversation early. I have some families that have decided not to disclose the condition to their own child. And I really struggle with that, because that child, and these are conditions that are not terminal conditions, that child is going to have a lot of difficulty adjusting when they become an independent adult. So start early, test the waters. We're talking as young as even toddler, especially if your child has differences that are visible. That can be really tough, and it can be isolating for a family. So helping that child understand their differences and how the community reacts to their differences and other individuals early will help them develop coping skills and strategies that they'll use for the rest of their life. So keep testing them.
Thank you. Dr. Lakaitis, is preimplantation genetic diagnosis available for the types of EDS that have known genetic causes, and would you recommend it?
Yes, I'm trying to think. I haven't had a patient who has chosen it specifically, but yes, since we know the specific genetic change, it should be completely available. I think to recommend it or not is a completely personal decision for a patient and their family. I think there are many families who decide that this is the right thing for them. There are many families who don't, and I can't advise beyond that, but I think from a technical point of view, these are they should be available and effective.
Thank you. Emily, how does a person know if it's time to leave the workplace due to declining health conditions versus adding more accommodations?
That is such a good question, and it's really going to be individual. You have to look at your work situation and see, is the culture going to support accommodations? Are they covered by the ADA? In general, I would always say try as many accommodations as you can before you make that decision. But also, I think you're going to know if it's causing problems for your health. You don't want to backslide or have any permanent problems. But yeah, it's really an individual thing. And I think if you write a pro and con list and think about it, maybe talk to some mentors about it, you'll know what the right answer is.
Perfect, thank you. And Scarlett, my doctor's appointments are so short, often just 15 minutes. How do I get the care I need, ask my questions, and educate my doctor all in that time?
So starting, I guess, with the educating your doctor. So I think a lot of patients find research articles and print them off and share them with their doctor, but they don't think about how little time their doctor has to read them. So I would say if you plan to educate your doctor in that way, I would certainly consider highlighting specific things that are relevant to your case and that you would like them to know rather than expecting them to read the entire article. And in terms of not having enough time for your appointments, that's where the planning really helps a lot. As others have mentioned, really making a plan for your appointment, writing out your specific questions so that you don't leave the appointment and remember things that you forgot to mention, and really prioritizing what is the most important and what it is that you want to get out of that appointment, because knowing what you would like to get out of it going into the appointment can help you achieve that goal.
Perfect, thank you. Okay, well, thank you to all of our speakers in the room and Emily at home. Thank you so much. Let's clap loudly so Emily can hear us.